practice with it. And this would be something that if you're going to have an emergency drill around the office, that just take 2 people and say, go get me the oxygen, turn it on, and the time that you want to be, you don't want to be fumbling around with this when it's time to, yeah. The other thing is about calling 911. Every doctor is going to have a different feeling about when they should call 911, when it's appropriate, when it's not appropriate. I've never heard of a doctor that got in big trouble for calling 911 too quickly. But you can get in big trouble for calling them too late. In my career, I've probably called 911 maybe 6 times in 30 years. What the process, and I go back to that red light, green light, yellow light thing. If you're sitting there and you feel like you're outside of your comfort zone with respect to how the patient is doing, then okay, I'm going to give myself 5 more minutes. And if I don't feel any better and this patient's not doing any better, I'm calling 911, okay? So as Lisa did, well, first of all, the card that I have basically reviews the steps, okay? Which is call 911, you answer the phone, and you talk to the person on the phone, but you get somebody else to go stand out in the street and wave the ambulance in, okay? Because you don't want them wasting 5 minutes trying to find your place, okay? What I typically do is I try to, once 911 gets there, and if they do decide to take the patient to the hospital, I will try to ride in the back of the ambulance with the patient. If I don't do that, I'm going to follow the patient to the emergency room and be there, okay? Cancel the rest of the day. I just think it's a good thing to do. And, typically of the 6 times I've had to send a patient to the ER, basically they sit in the hallway. It's like they're not doing anything. It's just they had gotten past where I felt comfortable, and if they went the next step, they'd be outside of my comfort zone. So I'd rather them sitting in the hospital. If they do happen to go to that next step, then people are already there. So, and the hardest time to call 911 is the first time. So it's not a badge of honor, in my opinion, that you've gone through your whole career and never had to call 911, But the hardest time is the first time. And I guess the other day, I went to a dental office. Actually, Austin called me, and I was halfway there. He said, the receptionist in the office is having chest pain. And I was like, really, Austin? You bothering me with this? And so he goes, no, it's really bad. I go, all right, well, what's her blood pressure? What's her blood pressure? He goes, I don't know. Well, take her blood pressure and call me back, I said, is the doctor there? She goes, no. He goes, the doctor's not here, He goes, it's really bad, though. I go, well, call 911. He goes, she doesn't want me to call 911. I said, well, take her blood pressure then, Call me back. I'm busy. So I pull up, and I go, did you get her blood pressure yet? He goes, yeah, it's like, I don't know, 200 over 110 or something. And I go, well, have you called 911 yet? No. I go, so I walk inside, and the lady is sitting there holding her chest like this, literally exactly like you see on, any picture. So I said, how long has this been going on? She goes, 20 minutes. And I go, okay, I'll be right back. Call 911, And then it was, we put her on some oxygen, got her blood pressure, and, EMS. And have you ever had any problems like this before? No. EMS shows up, changes her frickin' story. She goes, oh yeah, I've had this problem before. I mean, it just shows you what kind of ridiculousness and the liability that we put up with. Yeah. So instead of telling, it took EMS 5 minutes to get there. Okay. When I asked her how long it's been going on, she said 20 minutes. She tells these guys 45 minutes.
Yeah.
I ask her, she says, never had any problems like this. She tells the EMS guys a different story, which was more
I
involved.
had the same issue. The last time I called 911 here, I was working on a kid, and the mom, I want to say it was, but the mom was like, I don't feel good. She's like standing in the hallway. I'm like, what's the matter, dude? She's like, she's getting lightheaded, and she doesn't know. And I'm like, have you taken anything today? Oh, no, I don't take anything. I knew the woman personally. She was on like diet pills and Adderall. Well, okay, she got a little,
Mm-hmm.
got a little heated, but I called 911, and she was pissed. But I was like, okay.
Yeah, and
That's the person not even working on it. There's a person next to them.
yeah. So anyway, you just have to use your you just have to know that sometimes your patients don't tell you the truth, and that was part of the thing that I was telling you about there. The reason I was telling you that story, and the other thing is, it can be anybody, any place, anytime. I do want you to know that my life is so miserable right now that if I do have a heart attack right now, I want you to go wait 6 minutes before you call 911. Just do not resuscitate on me, okay? Huh? Yeah. Yeah. All right. So anyway, don't waste your time. All right. So anything else? Thank you very much.
I'm sure your kids will heard that.
Huh?
I'm sure your kids would appreciate that.
All right. Anything else? Any other questions?
That was great. Thank you.
Thank you very much.